Hello dear. Today we are going to talk about PLAB2 exam. This will be the first video in the series that I will upload later about the PLAB2. Today we will have overview about the exam. So what we will cover today in this video, the assessment criteria, exam format, what's expected from you in this exam, how they assess your performance in this exam. So let's start with PLAB2 exam format. PLAB2 consists of 18 stations plus 2 rest stations, which means that you will have total 20 stations. 2 of them are rest. Each station lasts for 8 minutes since you enter the cubicle, and you have 1.5 minutes before starting the station. This 1.5 minutes, you have to review the task, which will be placed on the wall before going inside the cubicle. So total 18 stations and 2 rest stations. In this table, you will see the topics and number of stations and what are the scope of the station or what could be covered in the station. So just to let you know that this number or the number of stations is not the accurate number, it's just approximate number. It could vary. However, just it will give us an idea about how the cases and the stations distributed over the topics. So regarding the medicine stations, it vary from 4 to 6 stations. Station could be history station, which will focus mainly on the history taking. It could be counseling station, and it could be ethical and medical dilemma. Surgery stations, it vary from 3 to 5 stations, and also it could be history taking station or counseling station or ethical station. For pediatrics, number between 1 and 2 stations, and it could be history taking, counseling, or ethical. For obs and gynae, it could be 1 station, and also it could cover history taking, counseling, or ethical issue. Psychiatric station, 1 station also, and it could cover history, counseling, or ethical. And also there's something called combined station, which is a mix between history taking and clinical examination, counseling and clinical examination. And there's combined mannequin or simman station. The number of stations for this topic between 4 to 6 stations. As I mentioned, it could be mixed, it could be pure examination or teaching. And we will understand about all of that later when we have the videos that explain these stations. So what are the passing criteria? What you have to do to pass the PLAB2 exam? We mentioned that the PLAB2 consists of 18 stations, so you have to pass 11 stations at least to pass your PLAB2. Regarding the passing mark, it's not a fixed number. It varies from exam to exam and depend on many factors. We can say that the average of passing score will be about 6 mark plus or minus 1.5, which means that passing score sometimes will be as low as 4.5 and sometimes it can be as high as 7.5 mark for each station. Also, you have to get a minimum score of 108 plus or minus 8 also, which means that minimum passing score could be as low as 100 and could be as high as 116. So you have to pass 11 stations and get at least 108 mark score. So what are the assessment criteria? So how the examiner will assess you and assess your performance in the exam. So there are 3 main domains you will be marked against during the exam. Each of them will have maximum 4 mark, which means that for each station, the top score is 12 mark. So the first domain is data gathering, technical and assessment skills, which covers history taking, physical examination, practical procedures, investigations leading to diagnosis. And just to explain a little bit more about that, so history taking, from what's written is history taking, you have to know how to take history and you know what you have to ask about in the history. Physical examination, you should know how to do the examination, how to gain a consent from the patient to do the examination. You have to know the steps you are going to do, and how to pick up finding. Practical procedure, it includes many things. For example, like IV cannula insertion, venipuncture, or insertion of urinary catheter. There's many practical procedures you have to be aware of and know how to do that. Investigations leading to a diagnosis, you should know what you have to order for each case, what are the benefits from each investigation, and you have to explain to the patient. If you are going to order a thyroid function test, you have to explain to the patient why you are ordering this test. This is the first domain. So data gathering, technical and assessment skills, maximum 4 marks, and it will assess you for these 4 points. The next domain is clinical management skills. And for this domain, they will assess you for formulating diagnosis. Are you able to make a diagnosis? Explaining something to the patient. So for example, if you diagnose patient as a rheumatoid arthritis case, you have to explain to the patient what does that mean. And if you will prescribe any medicine, if you will prescribe any procedure or any non-pharmacological management for the patient, you have to explain to the patient what does that mean. So here they will assess your ability to explain to the patient either the diagnosis or the management or the investigations. Explaining something to the patient and then formulating a management plan. Are you able to place a management plan for the patient, starting from the explanation and ending by the safety netting? And we'll know about all of that when we talk about the approach of the PLAB 2 exam and how to do the clinical management appropriately. It will be done in another video. The third domain is interpersonal skills. And in this domain, there's many things you have to know. They will assess you on how you will approach the station, if you are able to establish a rapport with the patient, and how you use open and close-ending questions, how you explain the diagnosis, investigations, and treatment, and how you involve the patient in the decision-making. For this point, it's very important when you reach to the management to involve the patient in the decision-making. For example, if you would like to ask the patient to do certain type of exercise, for example, or start to lose weight or stop smoking, so you should not give patient instruction. You should not tell him you have to lose weight, you have to do regular exercise. No. You have to discuss with the patient the available options, and you have to make sure that it suits the patient and he has agreed what you explain. So that's what we mean by involve the patient in decision making. And instead of giving patient instructions, you have to give patient options and let him pick up from these options. The next point is communicating with relatives. Sometimes you will have stations where you will talk to a relative, not to the patient. How you communicate with other healthcare professionals. Sometimes you will have stations with a colleague, so you have to know how to communicate with your colleagues. Breaking bad news. So in interpersonal skills, they will check how you will break any news, how you will break any bad news. And next point is seeking informed consent, clarification for invasive procedures. So if you are going to do any procedure, like inserting any catheter or putting an IV cannula, so you should not go directly and put the cannula. No, you have to explain to the patient what are you going to do and what are the benefits from that, and at the same time to gain a consent. The next point is dealing with anxious patient or relative. It includes also dealing with difficult patient or angry patient. So how you will deal with this patient will, of course, be assessed under the interpersonal skills. The next point is how you will give instruction on discharge from hospital, and how you will give advice on lifestyle, health promotion, or risk factors, and all of that included under counseling. So you should know how to do counseling for the patient. Also, it will be covered in one separate video. So now we have 3 main assessment criteria or 3 main domains. Each of them will have score of 4, which is the maximum. and then you have to score in each station. We mentioned the passing score between 6 as average. So that means if you get 2 points for or 2 marks for interpersonal skills, 2 marks for the clinical management, and 2 marks for data gathering, so this means total 6, which is the usual average for passing the station. So talking about the station itself, what you will have and how you will have information for the station. It's called the task paper. Task paper, it will be a paper which will be fixed on the wall outside the cubicle. You will have 1.5 minute to review this task before going inside the cubicle. Also, you will have this paper beside the patient inside the cubicle if you would like to take a look on it again. So in each task paper, there's many points will be mentioned, and you have to be aware about it and what are the benefits of each point. So for example, when you have this task paper or scenario, for example, it's called also scenario. So first of all, you have to know who you are, because knowing who you are will give you an idea where's the station and what's expected from you. So usually it will be a foundation year 2. Usually it comes like that. You will be a foundation year 2, and then they will mention you are working in this department, A&E department, medicine department, however. So first of all, you have to know who you are and where you are working. The second piece of information you will have is the patient details, what's his name and gender and age, and why he is here today, what's his presenting complaint or current or what's his illness. Sometimes they will mention if he has any chronic illness. Sometimes you will have another information about the patient, like his past medical history, personal history, social history, and all of these are plus or minus, which means it should not be there, but sometimes you will find this information. Also, you may have the vital signs of his observation, like blood pressure, temperature, and pulse rate, all of that. And sometimes you can find finding of some investigations. The next point, the next thing you can see in the task paper is what you must do, and this is very important because based on that you will know what's expected from you in these stations. Some station will focus mainly on the history taking, some of them will focus mainly on the management and counseling, some of them will focus on examination. So you have to know what's expected from you or what you have to do or what you must do in this station. So the task well, you have to follow what's written in this part. So as I mentioned, they can ask you to take history, to assess patient, to discuss about the management with the patient or with the examiner. So you have to read carefully what's written at the end of the task paper and at the end of the scenario to know what's expected from you. Sometimes there's some additional notes or special notes. Also, it will give you some more information or extra information to clarify the task. So for the task paper, as I mentioned, it's important to read it carefully in the 1.5 minute. You have to know who you are, where are you working, and who is the patient, what's his age, what's his complaint, and if there's any past medical history or any medical background about the patient is given, and you should know what you have to do exactly in the station. Okay, so this is a very important slide. I would like you to focus on what we will say here, because based on this slide, you will know what you have to do in each station in your PLAB 2 exam, even if this station is a quite new station. So there's 4 main points you have to know in each station, and you have to cover all of these points while you are preparing for the PLAB 2 exam. First of all, you have to have a structured approach, which means you have to know how to take history, you have to know how to do a counseling, and you have to know how to do a clinical examination and procedures. So this is the first thing. Without having basic history taking skills, it will be a disaster. Without having the basic knowledge about how to counsel the patient, it will be a very bad things. Of course, you will not be able to practice well, and even if you start or try to memorize what you have to do in each station, that means if you have any new station, you will not be able to cope or you will not be able to manage. So the first thing, you have to know how to have a structured approach to each case or cases in general, and it will cover how to take history properly, how to do examination, and how to counsel the patient. For this point, we will cover it in a separate video, how to have a structured approach for PLAB 2 cases or PLAB 2 stations. The second thing, you have to know what you have to ask about. This point is very important because many doctors, when they went to the station, they try to ask about everything. They will ask about everything in details, which is not correct. For each station, from the main complaint, from the task paper, you should have an idea for which you are going to ask about. And just to explain more, this question or the question you will ask a patient about should either to confirm your diagnosis or to rule out a differential diagnosis or to cover the red flags. So what does that mean? For example, let's give an example which we will see later in the next few slides. If you have patient with suspected gout, patient is coming with inflamed tender right big toe, for example. So from the task, you are expecting that the patient has gout because inflammation and tenderness and pain of the big toe, usually it's the classical presentation of gout. So when I'm going to, when you go to the cubicle and start to talk to the patient and ask him and opening the consultation with open-ended question, the first one, for example, how can I help you? And then he'll give you the main complaint, and then you'll ask him to explain more about his complaint. So later you have to confirm your diagnosis, which is a gout. So you will ask more about the pain and the character of the pain, if there's any swelling of the joint, any other joint affected, and is there any precipitating factor. All of that you have to ask about to confirm your diagnosis. So you will ask about all informations you know about the gout that can confirm your diagnosis. And then you have to ask other questions to rule out the differential diagnosis. What will be the differential diagnosis? For example, if the patient has any trauma causing his pain, so you have to rule out the traumatic cause. If the patient has any other joint disease like rheumatoid arthritis, if the patient has any infection, for example, like septic arthritis. So that's what we are covering in differential. Between differential, there is something we call red flags, which means the serious conditions that should not be missed. In this case, what you should not miss, for example, is osteomyelitis or septic arthritis. So you will ask about any fever, any limitation of movement, any systemic manifestations that can confirm your diagnosis of septic arthritis. Okay, so that's to explain what does that mean for this point. So you have to know what you are going to ask about. So what you are asking, either to confirm your diagnosis or to rule out other differential diagnoses or to cover the red flags. All of that the examiner will look for in your test. The next point, you have to know what you have to know what you have to know about this case. So what you, for example, a case of gout. So you should study well about gout. If you didn't have any background about gout, you will not be able to ask a question. You will not be able to answer patient questions. You will not be able to ask for investigations, for example. So you have to have a good medical background. So regarding, for example, we give example of gout, you have to know what are the causes of gout, precipitating factor of gout. So when you will ask the patient, you will ask about if he's drinking alcohol, if the patient has any previous episode before, if the patient is taking any medications that can precipitate the gout. So knowing the causes of gout will help you to ask about these points in the history taking. You have to know about the presentation. So what are the characteristic features of gout? So from the complaint of the patient, you will pick up that this is a gout case. What are the investigations? What are you going to order? You are going to order uric acid level or urate level in the blood. You are going to order for inflammatory markers like ESR or CRP, for example. Sometimes you are going to order the urea and electrolytes to make sure that his kidney is not affected. So you know what are the investigations done for this case and what are the benefit of each investigation. What are the differential diagnoses? So you'll be able to know how to ask about each of these differential. And what are the management plan? So when you reach to the part of the management in your consultation, you will know what are the plans you will put, what are the plan you will put for the patient for his management. Either you will treat him medically, with medications, or there is a non-medical treatment like lifestyle advice. Is there any investigation need to be done? Is there any referral or criteria the patient should fulfill to be referred for a specialist? All of that you should know. So from where you will have all of this information if you have a strong medical background about this condition. And the last thing, you should know or expect what are the questions patient could ask. So while you are studying, for example, case of gout, so what could the patient ask you? You have to think about it. And in each station, there's many specific questions frequently asked. So a patient could ask you about the options, treatment options, what are the complications? For example, what will happen if I didn't have the treatment? What are the side effects of the medications? All of these questions could be raised by the patient. So you have to be prepared to answer these questions. So for this slide, in this slide, it mainly show you what you have to know in each station. And based on that, you will know how to perform in each station properly and get the highest score you can get. Okay, so here is a sample of OSCE station, and this sample from the official GMC website. And there will be a link of this station or this sample OSCE. I'll put it in the description of the video. So in this scenario, we'll have first thing the task itself or the scenario. As we mentioned, you have to read it carefully to know who you are, where do you work, who is the patient, what is his presentation, and what you have to do. So if we read this slide, you will find that you are foundation year 2 doctor working in rheumatology unit. You are told that the patient James Horton, aged 45, has been referred by his GP with pain in the right big toe. You are not given any other information, and what you have to do is you must assess and manage the patient. You will be given 8 minutes to complete the scenario. So from this task, you can see that you are F2 working in rheumatology. So working in rheumatology unit will give you an idea that your case, of course, will be a rheumatology case. The patient is 45 years old, male, and referred because of right big toe pain and swelling. Okay. There is no other information. That means there is no investigation result, no x-ray, nothing done for him, just he was referred directly by his GP. You have to assess the patient and manage the patient. So assess, it can include the examination also. So you have to know how to take history from this patient and how to examine him and how to formulate a management plan. So from the GMC website, they explain later that what will the examiner look for. They mentioned that the examiner wants to see how you demonstrate the behavior that we expect from a doctor in general. So you are going to do the exam as a doctor. So they are expecting you to act as a doctor. And as I mentioned earlier, that they will assess you against 3 main domains: data gathering, technical and assessment skills, clinical management skills, and interpersonal skills. In the next slide, I will show you what they wrote on the website that they are looking for in this case, or what they would like to hear from you in this case. So if you hit this point in your station, that means you will get the score of the high score of this station, and you will pass the station. So first of all, they mentioned you have to find the history of acute recurrent monoarthritis, which respond to non-steroidal anti-inflammatory drugs. So very important from the history taking that you will ask about the condition, if there's any previous episode, which means it's recurrent, and of course you will ask the patient what he did for this pain. So he will tell you, for example, I'm taking ibuprofen or whatever the non-steroidal he will take, and he will let you know that this medication help him to ease his pain. Second thing, you have to demonstrate to pass this station that you have to find the medical history of any medications, any trauma, as we mentioned, to rule out the trauma as a cause. And if the patient has psoriasis or whatever, some medications like diuretics can precipitate gout attack. So you have to ask about the medical history in this case. You have to find out appropriate lifestyle history. If patient is drinking alcohol, what type of food he's eating. Sometimes the high purine diet can precipitate the gout episode. And the next point, make a diagnosis of possible gout. So to reach to the diagnosis of gout, this is one of the things they are expecting from you in this station. How to recommend appropriate management for this patient. And then how you will identify patient concern, and you will listen appropriately and display empathy. So during the video we'll make for the structured approach, we will explain how you will explore the patient idea and concern and expectation. So it should be done in all stations. Next thing, or the last thing, if you will conduct the consultation fluently and professionally. So that means that you have a good English that will allow you to communicate with the patient and explore his idea and concern, and how you will explain to the patient. So in this case, if you cover all of these points, most probably you will pass the station, and how well you will do will reflect on the score, if you can get higher score or even get the full mark for this station. So there is other additional note. They mentioned also that in some stations, you can be asked to complete prescribing chart. And for that, they publish on the website prescription chart to give you an idea. So now we are going to take a look on this prescription chart that was provided by the GMC website. We'll try to go through it and explain what is the meaning of this chart and how you should fill this chart. So now we can see they put a prescription chart. It's taken from Blackpool Teaching Hospital. So this chart is a little bit different in each trust. However, the main principle is the same. So you should be familiar with this drug prescribing chart, because sometimes you could face it in your exam, and you should know how to fill it in the exam. So first of all, you will have the identification part, the top left part here. It will show you the identification of the patient. What are the wards, what are the hospital, and name of consultant, what are the date of admission, what is the weight, height of the patient, and what are the date this chart was written in. And here the patient information, his hospital number, his name, his address, date of birth, and NHS number, of course. Okay, so this is the first thing you have to fill in each drug chart. It will be followed by the allergy box. It should be tagged in all patient. If the patient has any allergy, you should write it here, and you should write what happened exactly for this medicine. And if there is no allergy, you should write there is no known allergy, NKA. Okay, and then you write your name and sign and what are the date. Then after that, you will have first part of the drug chart. It will be for the once only medication or pre-medications. To explain that more, sometimes you'll write stat medication. You want the nurses to give the patient medicine immediately, so you have to, and it will be only one dose, so you will write it here in this part. And sometimes pre-medication, if patient, for example, is going to have a colonoscopy or something like that, and he needs to have a bowel preparation, so you will prescribe in this part the pre-medication for this procedure. So if you take a look here, you will find the date required. You will put the date and time when exactly you want him to take the medicine, and then here you will write the name of the medicine, how it should be given, if it is oral, intravenous, intramuscular, what are the dose, and then you will sign here. This part will be covered by filled by the nurses who give the medicine and who check for the dose and check for the medication and when it was given. So this is the first part of any drug chart. Then if we proceed more, you will find a part for the oxygen. And for this oxygen part, you have to write when exactly patient will need it. Usually you will mark all of these box. That means patient will have oxygen at any time of the day, morning, midday, evening, bedtime. In some other drug chart, you will find here numbers. It will be, for example, 9 to 8 morning or 8 to 9, for example, here tea time, here lunchtime, which will be at around 12. And here evening, it will be at about 5 p.m., which is tea time, and then evening or bedtime to be around 10 p.m. Next is the antibiotic. In the antibiotic, it's very important for antibiotic. There's you have to specify what are the indication and the duration of the antibiotic. It's very important. So you will put the name of the drug here. For example, you are prescribing for the patient Comoxiclav, for example, and then what are the dose for if you'll give it IV, it will be 1.2 gram, for example, and then wrote IV. Starting date and stop date is very important. And then here you will sign indication should be written. So you are giving Comoxiclav for let's say patient has community acquired pneumonia. And then here the date, and then here you should it should be mentioned here how many times per day it should be given in this part. Is it once daily, twice daily, 3 times daily, or 4 times daily? So in antibiotic part, it's important to put the drug, dose, route, and start and stop date. Sometime you will start patient on broad spectrum IV antibiotic till you have the result of the culture. So you will write starting date, for example, 12th of July, and then stop date you will write here review after 3 days, or review after 4 or 5 days, or review after the blood culture, for example. So, but you have to put something here so it will be known for how long patient will take this medicine and if need to be reviewed later. This is regarding the antibiotic. So for the next part, this is the regular medications of the patient. Here also the same name of the patient and where is the patient. And then this is the regular medications. For most of medication in the hospital, you will do something called VTE prophylaxis, the prophylaxis for venous thromboembolism. And it differs from hospital to hospital based on the policy and guidelines, but usually dalteparin will be given. Those will vary. I saw some trust using 4,000 units and some trust using 5,000 units. Subcutaneous, it's usually taken evening around tea time here. This is regarding the dalteparin, and sometimes patient will not be eligible for dalteparin. For example, patient coming with bleeding, so you will not prescribe any medication for him, but you will use anti-embolic stocking, or sometimes they call it TED stocking. So you can use it instead of the medicine. And then the rest is medication. You will put any drug. For example, patient is taking atorvastatin. You will put here atorvastatin, 20 milligram orally. And the starting date will be the date of admission. There is no stop date because this is a long-term medication. So you'll write here chronic or long-term medications. And then you will sign here, you will put your PLAB. And then, for example, atorvastatin is taken at bedtime. You will sign or make circle around bedtime. This is for all regular medications. So regular medications, there will be many pages for regular medications. After regular medications, there is something called as required or PRN medications. So patient suddenly complain of pain. So you would like to give him some painkiller, but not regularly. So you'll put it here in the as required or PRN medications. So you write here paracetamol, indication is pain or headache or joint pain, back pain, 1 gram orally. Frequent, it will be PRN /QDS. This is the maximum per day. Or you can put here the maximum. You can write here PRN and then here maximum is QDS, and then you will sign. So that means the patient will take this medication when required, if it is PRN medication, not regular medication. The next part is the anticoagulant treatment. It's mainly for warfarin. So if patient is on warfarin, you have to write it daily here. And sometime if you are doing or monitor the INR, because the value is above or lower the target, so you should write the date and the value of INR, what are the dose, and then you will sign. But it should be filled in this part. Some patient will come with yellow book. You will know about it later when we talk about the station of the warfarin. This yellow book, you could prescribe the medicine also in his yellow book, either in yellow book or in this part in the drug chart. So here's just small box here. If patient didn't take his medication, it should be specified in the drug chart why he didn't take the medication, and it's done by the nurses. So for example, patient could refuse. So you can find the number 1. Let me show you back here. If you go back here for regular medicine, for example, here, this box is regular medicine. We said that atorvastatin, and it should be given at bedtime here. Okay, and here is the date. So we expect it to be ticked here in this box that it's given. Sometimes you can find here number 1, 2, whatever. So when you see this number, you have to go to this box to know what does that mean. So if you found 1, that means the patient refused to take his medicine. Number 2 is patient is not in the ward. For example, he's went to have X-ray or CT or whatever, so he's outside the ward at the time of the medication. If patient is unable to receive medication or whatever the cause, if patient is nil per mouse, or if medicine is not available, sometimes medication prescribed is not available and they are waiting for the pharmacy to supply the medicine. If self-administered, sometimes patient will have his blister pack with him, which is a bag or box contain spaces for days, and each day has a tablet put it inside. So patient sometimes take his medication by his own. And 7, it could be other reasons, and at the time it should be written what are the reasons. Okay, so this is simply how the drug chart appears. There's other couple of pages in each drug chart which is not shown here. One of them for the fluid prescription, if you prescribe any IV fluids or IV medications, and there is other part for the insulin, so which is not included here. So however, they didn't show it in the GMC website, so I will assume that it's not required from you. So this is regarding the additional notes. We cover it now, and that was today video. I would like to thank you for watching this video. If you like the video, please press the like button. And if you'd like to have any new video from the channel, I would like to ask you to subscribe for the video and support me.